everyone, and welcome again to The Doctor is In. We hope to provide you with the virtual care that you need during this time of the pandemic. I'm Dr. Freddie Gomez, and from the beginning of the pandemic, testing has been emphasized as incredibly essential in the fight against COVID 19. What's happening right now is we are building up our testing capacity in the country. Testing is now becoming more accessible and widespread with the combined efforts of both the public and the private sector. We're going to talk a lot more about testing today, so let's welcome in Dr. Mary Clare Coronel. She's an infectious disease specialist and she's also the chairman of the Infectious Control Committee at the De Los Santos Medical Center. We're glad you could be with us today, Dr. Coronel.
Good afternoon po. Good afternoon, everyone.
Now, we've been talking about testing since the early days of the pandemic, but let's remind everyone why it's needed and why it is so important.
Of course, when we do testing, we are able to identify who are the COVID suspects and then eventually who will become positive. So that's important for us so that we can isolate these individuals, thereby preventing, of course, further spread of the disease to other people. And of course, giving them the proper treatment.
That's right. So the idea really is to identify the patient, followed by isolating and treating the patient. So that's something good to keep in mind. And as we intensify our testing, we want to talk about the different types of testing. Now, Dr. Coronel, let's talk about that first. Let's talk about the different types of tests. Actually, there's only two main tests available right now.
Yes, Doc Freddy. So we have, of course, the RT-PCR, so a real-time PCR. So that detects the COVID virus itself. So it's the antigen itself. And we also have the rapid antibody test. So as the name implies, it detects the antibody. But of course, we will prefer the RT-PCR. It's the real recommended test for detecting the disease. While the RAT or the rapid antibody test, it cannot be used as a standalone test in the diagnosis of COVID-19.
That's a pretty good explanation that you did there, doctor. No, so ang preferred talaga is the RT-PCR. Yan ang pinaka kumbaga gold standard when it comes to testing for COVID-19. And the other one, the rapid test or yung lateral flow test, is something that measures just the antigen, hindi niya minimeasure yung virus mismo. So now that we know about the types, now we want to talk about the process. For the PCR or the polymerase chain reaction, an individual will need to get a swab. Now, Dr. Coronel, could you please explain the swabbing process and why it's done that way?
Okay, so we did two specimen samples. So we have the nasopharyngeal sample. So we have a, siguro in simpler terms, parang cotton stick applicator siya. So for the nasopharyngeal, that's a thinner one. And it's a little bit parang smaller lang. So we insert it in the nose through the nasopharynx. And then the other one, we have the oropharyngeal sample. It's a little bit bigger or parang mas mataba yung pinaka-tip niya. And then we swab the posterior pharynx. So we need to, well, ideally, sana dalawa yung samples for for the testing so that the yield becomes higher. Yan, Doc.
Okay. So the reason why also no, a doctor is the reason why they get it from the nose and from the throat is nakita nila na ang SARS-CoV-2 virus which is responsible for COVID-19 dun sila gustong mag-accumulate dun sa area na yon. And I'd like to correct myself earlier. I mentioned that the lateral flow or the rapid test this measures the antibodies present and not the antigens. Okay, so now there so far with this, the COVID-19 cases, as we all know, we see it every day, they are still increasing. There's no cure yet, there is no vaccine yet available. So kung kailangan lumabas, we need to take extra precautions. Alam na natin yan. We have to wash our hands frequently and properly. We have to always wear a mask. So at least a cloth mask. Kailangan nakamask tayo palagi. And we must always maintain social distancing. So paulit-ulit namin yung sasabihin sa ating mga viewers. Now let's answer some of your social media questions. We have a question from Kayla Ruiz. Ang tanong ni Kayla, if the test results on a rapid test is positive, what should I do?
Okay, so as I've mentioned earlier, it mustn't be done as a standalone test for diagnosis. So if your test turns out positive, regardless if kung yung IgM man positive or negative, because you detect IgM and IgG antibodies, ideally you need to do a rapid, an RT-PCR test and do quarantine for 14 days or until your symptoms are resolved. So if an RT-PCR test is not available at that time that the rat test is positive, then we just do quarantine for 14 days or until your symptoms have resolved.
Okay, and with regards to rapid testing, as we mentioned earlier, this test, the rapid antigen test, is a test that identifies the presence of antibodies, which the body produces when a person gets sick. So, in order to fight the virus or the illness, the body will produce antibodies for that. Now, the challenge is sometimes you get tested before the antibodies become present in your body, or you don't have enough antibodies yet when the test is done. Let's explain that more to our audience, Dr. Coronel.
Um, the rapid test or the antibody test is composed of two antibodies, right? So we have IgM, or for the recent, it tells us that you're supposedly having a recent infection, and then the IgG, it's parang past infection na siya. Yun. So that's why the antibody test is not really recommended for asymptomatic individuals because as you've said, Doc, yun nga po, there is a period na wala pa kasi siyang symptoms. So the virus is just inside your body. It isn't producing any symptoms at that time. So, syempre, si antibody is a response to your virus or to your antigen. So, after some days lang, saka pa lang siya lalabas, si antibodies. That's why antibody testing is actually recommended for those with symptoms. Kasi by that time, your body has already mounted a response to the virus. While for asymptomatic individuals, although the transmission is less, but the RT-PCR is what is recommended for those individuals without symptoms or yung sinasabi nating pre-symptomatic individuals, yung nandun pa lang sila sa, yun nga, dun sa time na nandun na si virus, pero hindi pa siya nagsi-symptoms.
That's right. So we have to pause for a quick break, but as we all know, many private companies and individuals are doing their share to augment our country's capacity to test. And among those companies is San Miguel Corporation. The conglomerate now also has an RT-PCR testing laboratory. We'll take a tour after this short break. You're watching The Doctor Is In. Welcome back to The Doctor Is In. I'm Dr. Freddie Gomez. Since the beginning of the COVID-19 pandemic, health experts have been highlighting the importance of testing. The more people are tested, the sooner they can be diagnosed, isolated, and treated to prevent the spread of the coronavirus. The country now has more than 60 laboratories and counting. I visited a soon to be opened RT-PCR testing lab to understand how it is all done. Let's all watch this. After a person undergoes a nasal and throat swab for COVID-19 testing, respiratory specimens are taken to a laboratory for confirmatory testing. The PCR test uses mucus, typically taken from the nose, throat, or both. The goal is to look for genetic material of the coronavirus. The highest priority in laboratories is to make sure their workers are safe, since these frontliners work with hazardous materials. In this particular situation, it's the deadly coronavirus. I visited the soon-to-be-opened San Miguel Corporation RT-PCR testing laboratory. It's critically important that equipment and biosafety standards in laboratories are in place. Among them, advanced airflow control technology. With this system, positive and negative air pressure clean rooms. It's an isolation technique to prevent cross-contamination.
The DOH has really provided us with a good list on how to really build a molecular laboratory, and we followed all their specifications to a T. If you can feel the air actually here, there is a negative pressure. Some rooms are negative pressure and some rooms are positive pressure. We will go through it later, but as you can feel, there's a little push so that the air would be sucked out and there'd be no chances of contamination going out of the laboratory.
Another risk consideration is the unidirectional airflow, which refers to the air in a room flowing in a straight, unimpeded path.
We don't want the clean air to get mixed with the bad air. Of course, as people are processing infectious material inside, we don't want them probably bringing something to the outside or the air which is clean. So as much as possible, we preserve that.
The clean room system in medical facilities controls and contains airborne particles, contaminants, and pollutants. This is why laboratories have a pass box. It's used to transfer materials from one side of the lab to another to minimize contamination.
There are two doors inside pass box, one from one side of the room and one the other side of the room. So the idea is when you put something inside for it to get transferred to that room, you close it first before the other one opens it. So we preserve as much as possible, again, the unidirectional. So this would matter a lot, especially in some of the areas that could actually give out some contaminations. For example, in the area for the PCR later on where they're multiplying the numbers of these inactivated viruses, you don't want that to go inside and get transferred to some of the regular specimens that might not have it.
All laboratory workers are required to wear appropriate personal protective equipment from head to toe. This is to safeguard both themselves and the sterility of the facility. This is the area in which the personal protective equipment is stored. One of the lab technicians will be able to put these onto themselves and be ready to be entered the main laboratory.
We would do it in a particular way. So there's a particular sequence wherein you put on the personal protective equipment so that from this point on, you can't enter the lab without PPE on. But for now, since we haven't really started processing, so we can still go inside in our outside clothes.
Now we're ready to go inside the specimen receiving room.
So this is where it's gonna come in. This is the other side of the door, as you can see. So there'll be minimum interaction between the person outside and the person inside. So once the sample is there, we take it out here, and this is where we open the packages. Again, this is a biosafety cabinet. It has its own filter and it has its own airflow to prevent any viruses or any infected secretions to come out of the biosafety cabinet. So it's contained here. So
Okay.
this is where we open the packages. We don't open it outside. It has to be inside the biosafety cabinet.
From the biosafety cabinet, samples are taken to the specimen processing room through another pass box.
We don't want the staff working here to get infected. So, as you said a while ago, every specimen is being treated infectious. So, first step is to externally disinfect or decontaminate the sample container. And after that being done, it's going to get transferred to the specimen extraction area through, again, a pass box.
Okay.
So, open it first, put the specimen there. We have some two-way radio because it would be very hard for the people working in this room and the people working in the other room to communicate without these doors open.
Okay.
So once they place the samples inside here to be processed, they use the radio to contact the other room.
Samples that can't be processed right away are placed in a storage freezer to prevent degradation. From the receiving room, it's time to go to the specimen preparation room. This is where the specimens have already been opened. In this room, this is where the specimens are actually removed and reagents are used in order to test them if they are indeed positive for COVID-19. It's in this room that a step called RNA isolation or extraction is performed. When the COVID-19 virus enters the body, it releases its RNA. The RNA hijacks our cells, which then become factories of the coronavirus. They multiply in the body and attack the immune system. In order for the PCR machine to detect the virus in a specimen, that unique piece of RNA needs to be isolated.
What we do here actually is we distill the specimen to something that the PCR can work with. So what we need is actually the purified RNA of the coronavirus that we will be able to detect via PCR. And we can't just do that just by using the specimen that we get. So we have to process it and we have to purify it, and this is where that takes place. The first step would be really inactivation. The viral inactivation, essentially what it does is you kill the virus, so it's less harmful to the staff. So once we have killed it, we do heat inactivation for our lab. Our process would be heat inactivation, and then we will put them inside our automated extraction machine.
Okay.
So this is the NATCH. We have two. This is the automated nucleic acid extractor. Again, as I said earlier, you can't really use the raw sample as it is. It won't be able, the PCR won't be able to detect the nucleic acid. So we need to have it distilled into a pure form that we can use. It can process 96 samples in 1 hour.
It already does the extraction, number one, before you process, and then you do the templating. When we say the templating, we get reagents from this side of the room, reagent preparation. It's going to be mixed with whatever is extracted from the sample. And then when those two combine, you actually transfer it to the PCR room for amplification. So some of the extraction machines out there just do extraction. But specifically this machine, it does extraction and it does templating.
Now that the respiratory samples are prepared, it's time to send them to the PCR room.
What happens actually in the PCR is that imagine you're in a concert and you're standing on stage and there are thousands of people in the stadium and you're looking for one particular person. Good luck looking for that person. But what the PCR actually does is that it locates that one person in the crowd, makes multiple copies of that person, and then gives them light sticks. So you'll be able to detect them right away. So that's really what we look at. We look at the signal that is generated in the PCR to determine if the RNA is actually there. If it's not there, then it won't produce a signal. But if it is, we'll be able to see it.
Outside of these areas of the lab, there's also the reagent preparation room. A reagent is a chemical mixture used in swab samples to determine test results. This room is considered the cleanest in the lab.
This is the room where we prepare the master mix, which we will be using for the PCR. So it has to be really clean because any bit of contamination in here would spoil the entire batch.
This testing laboratory, built by San Miguel Corporation, can process 4,000 COVID-19 tests per day. Add to that, previous machines donated by the conglomerate to the government can process around 11,000 COVID-19 tests, which brings the total to 15,000 tests per day. That's a huge help in the government's expanded testing goal. That was really an interesting experience for me to walk through the testing process in a laboratory, and that lab will definitely be needed in the days ahead. In the meantime, a complementary tool to COVID-19 testing is tracing. We'll talk more about that right after a short break. You're watching The Doctor is In on CNN Philippines. I'm Dr. Freddie Gomez. We've been talking about COVID-19 testing and how important it is. The thing is, once you test a patient and we find out that the person is sick, doctors are able to isolate and then treat that patient. These steps help to stop the spread of the virus. And then there's contact tracing. We're still joined by Dr. Clare Coronel, an infectious disease specialist. Dr. Coronel, aside from testing, sinasabi ng mga eksperto na dapat sabayan ito ng contact tracing. What's the purpose of contact tracing and how does it work? Bakit ito napaka-importante din?
Okay. So contact tracing means we find or we look for the other persons that the confirmed patient had close contact with. So close contact, we can define it as face-to-face contact na less than a meter, then more than 15 minutes. Or for example, a healthcare worker, for example, such as me, I'm not wearing any PPE and then I'm handling a COVID positive patient. So it's important to do contact tracing so we can identify all the other persons who are at risk of developing COVID-19. As what I've said earlier, ang goal natin is to identify and to isolate and then to treat. So we can identify if we do contact tracing. So how do we do it? Well, actually the DOH does it. No, for kunwari, I'm a patient and then all my other contacts such as my family members, neighbors, yung CDOH actually ang gumagawa nun. Pero for example, sa case namin sa hospital, if we have a COVID positive patient, we do contact tracing by listing all the healthcare workers who were involved in caring for that patient. So like the nurses, the other doctors, yung mga janitors, we list them down, the names, and then we ask for symptoms daily. We have their temperature checked. They can have their own temperature check or pwedeng may isang point person kami to have their temperature check. And then if any of them develops symptoms at any point, then we advise them to do quarantine and then subject them to test.
Okay, so that's very important. We wish we had so much more time on this episode, but we have to say goodbye. Thank you very much, Dr. Mary Claire Coronel, for joining us. And thank you, too, to our viewers for joining us and sending in your questions. We hope we were able to answer some of your questions about COVID-19 testing. I'm Dr. Freddie Gomez. Stay safe, everyone. Thanks for watching.